Now, staying on the State of the Nation address, government says getting the vaccines for babies is a top priority of government and is being treated as an emergency. Now, President Akufo-Addo waded into the vaccine crisis while delivering the State of the Nation address earlier in Parliament. Now, the President alluded to the severity of this issue and said government is working hard to deal with it. Earlier, the Minister of Health, Akufo-Addo, gave assurances as to what the ministry is doing to ensure the crisis is curtailed.
We have had some vaccine shortages in the country since the last quarter of 2022. The vaccines in short supply are BCG, measles, rubella, and oral polio vaccine, OPV. This shortage is nationwide. The recent shortage in vaccines for measles, as regrettably as it is symptomatic of the steady global decline in measles vaccination since the beginning of the COVID-19 pandemic. And permit me to quote from a WHO recent publication on the subject that puts the challenge we are dealing with into perspective. And I will quote: measles vaccination coverage has steadily declined since the beginning of the COVID-19 pandemic. In 2021, a record high of nearly 40 million children missed a measles vaccine dose. 25 million children missed their first dose, and an additional 14.7 million children missed their second dose. A joint publication by the World Health Organization and the United States Centers for Disease Control and Prevention reports. This decline is a significant setback in global progress towards achieving and maintaining measles elimination and leaves millions of children susceptible to infection. And Ghana's Minister of Health has been making efforts to ensure we secure adequate stocks of vaccines despite this global challenge.
Well, today in Parliament, the President admitted that he is worried about the current situation and said that the government is working hard to ensure that they procure vaccines. He was unable, however, to give specific timelines. Take a listen.
The shortage of some childhood vaccines in the country has concerned me greatly. This shortage, if prolonged, will affect negatively Ghana's childhood immunization program, which has been recognized as one of the most successful in the world. The WHO has only recently expressed worry about a steady decline in measles vaccination coverage globally because of the concentration on the fight against COVID-19. In accordance with our desire not to become part of this global trend, government has taken steps to ensure the stocks of these vaccines are procured and supplied as a matter of urgency and emergency. The Ghana Health Service has developed an elaborate program to catch up on children who have missed their vaccine immediately stocks arrive. Mr. Speaker, I want to encourage all parents and caregivers to ensure that eligible children are vaccinated once this program begins. No child should be denied access to vaccination.
Meanwhile, pharmacist and CDD fellow Dr. Kwame Akufo-Addo has blamed the shortage of the vaccines on lack of planning and commitment by the government. He joins us via Zoom now. Doc, I'm grateful that you could join us. You had the president speak there. What's your reaction to his sort of assurances that vaccines will be procured?
I'll make an analogy. If you went to the filling station and there was fuel available, but you couldn't fill your car, what would be the reason? Would it not be because you don't have the money to buy the fuel? So there's not a global shortage of vaccines, but we do not have vaccines. What do you think the reason is? Because we do not have the money to buy the vaccines. And the reason is simple. Vaccines are priced in dollars. And therefore, to purchase them, you have to pay dollars.
Okay.
Our cedi has been depreciating.
Okay.
So the amount of money we budgeted in dollars to purchase the vaccines has gone down by about 54%. So we cannot purchase as much the number of vaccines we wanted to purchase then as we want to do now.
Okay.
And for me, that the government, nobody in government is saying we'll fix this problem by tomorrow morning or in a month's time. They are saying in the next few weeks. What's the next few weeks? Is it 2 weeks? Is it a year? Is it 18 months? They've created a problem where even you as a journalist cannot go and ask them, what's an update? Because they told you the next few weeks. So if you went to them after 2 weeks to say, is there any update? And they say, well, we said the next few weeks. You cannot do anything about it. And the president comes to speak in the House of Parliament and doesn't give any clarity and says he's concerned. That is what concerns me. He's concerned about something that he cannot give a timeline for. And that should concern every Ghanaian.
So for you, government is not being factual when they say that this is a global crisis and not peculiar to the country.
Well, you're a journalist. I entreat you to simply Google global childhood vaccine shortage and see if you would find out if there's any shortage of vaccines across the globe. There isn't.
Interesting.
The problem is we haven't planned properly because we didn't have the money.
Okay. Kindly hold the line for me. Let me bring in the ranking member on Health Committee of Parliament, Kwabena Kando, who's also been speaking about these vaccines. Honorable, let's start with your reaction to the president's assurances that I will or my government is trying to get in vaccines. Honorable, kindly unmute so we can follow what you're telling us, sir.
Can you hear me?
Yes, I can hear you clearly now. Yes.
Thank you very much. Thank you very much. I was just asking whether or not you are not confused yourself by the comments on by the president. Oh, it looks as if the president doesn't appreciate the urgency of the issues at hand. And the president said that should be denied of vaccine. That's exactly what is happening. For the past, months, we had this outbreak of measles in somewhere October 2022. Okay, and before you even detect the outbreak, it means that the vaccine has been in short supply for a very long time without, Ghanaians noticing it. So the president is not supposed to be lamenting like you and I. The president should be giving us solutions, just like my brother has stated. The president should be giving us, okay, it started from here, the outbreak, this is the number from in this district, this is how it's behaving, but God being so good, today we have taken delivery of so much of vaccines. Tomorrow we are going to start the distribution and embark on administering those vaccines and what have you. But if the president also keeps lamenting that he is concerned, that it is not about he being concerned that for us we are interested. It is about getting the vaccines to, administer to our children. Because now every child from 0 to 5 years is at a very high risk. And if you could recall, when we started this conversation on the shortage of vaccines, the Director General for Ghana Health Service said that we're going to take delivery of vaccines in 2 weeks. I don't know whether if you heard that. In 2 weeks.
So for you, what must happen? What must we do to ensure that we are able to get these very important vaccines in for our kids?
As early as possible. Even 4 months ago, if we had done anything at all and the vaccines were supposed to be crawling to Ghana, they would have arrived. So it's an emergency situation. Wherever we can get the money to buy the vaccines, we should. We should get the money and buy the vaccines as early as yesterday. Okay. So that is what is important. No matter the big English and the big explanations, what we need are the vaccines. We need the vaccines to vaccinate our children in the country. So for me, whatever, and just like my brother Kwame said, we do not have, you see, people keep misleading the president. And I feel so pity for him, those who write his speeches. Who tells him that there's shortage of vaccines? In fact, there were excess of vaccines for, with those vaccines in the international market. There were excess.
Okay, so you also then agree that it's because of money. We don't have the money, that's why we don't have it.
It's
Now,
the money issue. Because you see,
now on COVID-19, today the president publicly defended the disbursement of COVID-19 funds, over 25 billion Ghana cedis acquired for the fight of the COVID-19 pandemic. He clearly debunked claims, especially led by you, that the monies were misused. What is your reaction to this?
The president the president himself and his government, they were reckless. Simply reckless. Would the president justify that they should use the 2 million Ghana cedis for meetings in the less than one year? You see, this tells us that the president was behind every expenditure, and he knows about the recklessness.
Okay.
He approved the recklessness.
Okay.
And we will chase him with those recklessness. He should stop that clearing agent duties he has been performing. That in any time, any of his appointees is involved in this corruption and recklessness, he's the first person to come out and clear them.
Okay.
He
grateful to you.
Stop that clearing agent business.
Okay. I'm grateful to you, Honorable Mintakando, for joining us. Dr. Sapon-Sedu, your reaction to the president's defense as well. Just a minute for me, sir.
What I'd say is that we have a constitution in this country. In that constitution, it clearly says that the Auditor General has a mandate to audit how our monies are spent. And after auditing it, it has to go to Parliament, and the Public Accounts Committee has to make a determination as to the veracity or otherwise of whatever the Auditor General has put out.
Okay.
The process is still ongoing. And we have a president who is a former member of Parliament and a lawyer who understands our constitution, clearing people even before the processes are complete.
Okay.
And also knows that there's a parallel parliamentary investigation going on because there are other funds we received for COVID that haven't been yet audited. I find that disappointing.
Okay.
And that is my view.
All right.